which in Trisha land is like a 4 out of 5 for most of us. Okay, so we're just gonna always understand our patient and their pain scale, and then we're gonna go from there. Okay, so your patient's gonna lay down, they're gonna get comfortable, they're gonna get close to you. You're gonna be palpating the transverse process and actually the facet joint at each level, okay, as you go through and move their legs. This is also the setup for how you're gonna set up one of the lumbar manipulations. Okay, so this is kind of a good way to do that. Care if I lift your shirt up a little bit. Okay, you can do it through the shirt, it's fine. My hands are chilly, I'm sorry. Okay, you can do it through the shirt, that's okay. When you guys are in the clinic, you don't actually have to be skin on skin. It does help you though, we're gonna show you 2 techniques right here. Okay, this is gonna be the passive accessory glides. So I'm gonna find where the base, so if we go iliac crest all the way over, that's what level? L4, so if I go down, should be L5. If I just come lateral, okay, I should feel that base where I'm coming down into that iliac spine, so the ilium, and I'm gonna drop above it, okay, because I wanna be in where the space is. I'm not gonna be pushing on the ilium, okay, so we're above that. You're gonna bend their knees and they're gonna stack them. Does that hurt to stack your knees? A little bit. Can we, yep. Actually, really never done it with a pillow, so this will be new. But that's okay. We're just gonna roll with it. I'm gonna pull this down just a little bit. That feels a little bit better. Okay, so you want your patient close to the edge of the table as you can get them, okay? You're gonna take that bottom leg and you're gonna stick that bottom leg, so the table actually has to be at a height that you can move through your legs, okay? If I bring her legs and her hip into flexion, what am I doing at the lumbar spine? I'm flexing it, okay? And you guys are gonna feel that. So you're gonna wanna feel as you come from neutral through, you're gonna wanna feel the gapping happen underneath your hand, okay? What you should feel is there's a closing, there's a gapping, and then you'll feel the closing again as that top facet starts to close down in on you, okay? How did that feel? Yeah, nice and gentle. So this is where you guys a lot of times will, you don't know anything else to do, you're gonna do this, okay? If they're so severe, they've got pain all the way down their leg, and you can't find a direction that they like, you're gonna do this, okay? You might have to put pillows up against them so that they're not fighting, so that they're not having to support themselves. I'm gonna use my middle finger to feel where that gapping occurs at, okay? I'm not doing a lot of work here. You should not be holding your patient up through your upper trap, okay? You really do wanna stick them on top of your iliac crest into your abdomen, okay? And I'm just pushing through her, we can straighten this leg out just a little bit. I'm here, kind of distal, and I'm pushing her into my body, okay? And gapping her through that way. If your patient can't tolerate both legs, you can just do one. We can just leave this one down and straight, and I can just come through that top leg as well. Or let's say that I'm trying to do Thomas's legs, and I just can't quite get it, and I'm working too hard, I can just do one, okay? You're gonna work yourself up the lumbar spine. As you get higher, you're gonna feel less motion, okay? You're gonna have to go into more flexion, but a lot of times we don't want to do that, okay? Shoe fly, okay? All right, so does that help you guys? Okay, so that's number 1. That's, you can do some gapping from up. You're gonna take the, really the ribs and ride cranially. You're gonna take the ilium and ride caudally, okay? You're gonna cross your hands. You're not gonna cross your hands. You're gonna start with your elbows in towards the center of your body. You're gonna use your elbows to pull out, okay? This is nice. So at the same time, you're gonna take your middle fingers and you're gonna do a P to A glide at the same time. So you're gonna get close, bring that patient into you. As you separate, you're gonna give just a little glide through there. How does that, oh. Sometimes we're gonna be pushing up here hard and they're gonna have some trigger points into those lats. So just make sure you assess that, okay? This will always probably feel pretty good to take that and gap down, all right? So just know that this one can be a little bit sensitive and you might have to adjust your pressure. So if I come in, I'm rolling onto the top of my patient, I'm gonna use my middle fingers as I come to apply that P to A and then glide it. You can add just a little vibration at the same time just to try to get some of that to loosen up. And you're gonna go through each level as you go through there, okay? You'll find, like on Trisha, right here is really kind of where she's stuck at. So really, she wants me to just hang out here all day, okay? All right, feels good? Yeah, she wants to stay here, so. Questions about this? Okay, so what are you guys gonna practice? Your PIVMs, okay? It's all about your hips, okay? So you guys should not be like, oh God, I can't move, okay? So get into a little bit of a squat. Your hips come back behind you, all right? And you're moving, you're just shifting your weight, okay? From side to side. And then when you get into here, key thing is that you've got to get your kind of body up and over so that you can really gap them, okay? Try applying that P to A force as you go through that.